Great. Good evening, everyone. Welcome to our Community Informational Forum on the COVID-19 vaccine, specifically for trans, non-binary, and gender expansive community members. My name is Tre'Andre Valentine. I am the Executive Director of the Massachusetts Transgender Political Coalition. My pronouns are he and they. And here today, we've got a panelist of medical experts who in a short moment will introduce themselves. I just wanted to go over some housekeeping things really quickly. This forum, this webinar will be recorded, so will be made available afterwards. We have ASL interpreters for those who are deaf and hard of hearing. We also have a live captioner. We will be doing the way this will flow is that we'll have our round of intros. There will be a short presentation, and then there will be time for a Q&A. And if you have any questions throughout the presentation or as we are having conversations, please put those in the Q&A, and we will definitely get to them as much as possible. So this presentation this event is presented by the Massachusetts Transgender Political Coalition, GLAAD, and members of the Massachusetts Trans Health Coalition. And we have two of our members here today, Pam Klein and Carl Streed. I'll let them introduce themselves. Pam, would you like to introduce yourself?
Sure, thank you so much. I'm Pam Klein. I use she, her pronouns. I'm a nurse. I work two different jobs. I run a transgender program at Boston Healthcare for the Homeless program, and I am the nurse liaison at Boston Medical Center's Center for Transgender Medicine and Surgery. Very happy to be here. Thanks.
Carl, would you like to introduce yourself?
Sure, I'll jump in. Hi, Carl Streed, he, him, his. Thanks for having me. I'm a primary care clinician at Boston Medical Center and the research lead for our Center for Transgender Medicine and Surgery. So I split my time between providing primary care and addressing research questions as they relate to broadly anything related to the health and well-being of transgender persons. So thanks for having me.
Thanks, Carl. And we have Will, who is joining us from Rhode Island. Will.
Hi, everyone. I'm Will Perez. I'm a family medicine doc by training. I'm the medical director for the Tri-County Health Centers in Johnston, North Providence, and an assistant clinical professor at the Brown Medical School. I was appointed last year to serve on the vaccine advisory committee for the state. So that's been quite the trip. And so we'll see, we can share some of those details as we go, but I'll be representing Rhode Island in this. Not too much is different from Massachusetts anyways.
Awesome. Thank you, Will. Okay, so now we're going to move into the presentation section. And after this, we'll have time for Q&A. So I'm just going to go ahead and share my screen. Make sure that our ASL interpreters are spotlit. Okay, great, wonderful. So welcome to our forum about the COVID-19 vaccine. These slides were put together by the Massachusetts Department of Public Health. We've also tailored it a little bit so that is for our communities, for our trans, non-binary, and gender expansive community members. Like I mentioned before, this is presented by the Massachusetts Transgender Political Coalition, the GLBTQ legal advocates and defenders, and the Massachusetts Transgender Health Coalition. So before we start, just want to acknowledge that historical and current oppressions such as structural racism, classism, ableism, homo, bi, transphobia, and other forms of oppression have made it difficult for our communities to fully trust the public health, medical, and scientific community. We want to be open and honest about the safety and development of the COVID-19 vaccine, what we know and what we don't know. Just quickly to start, what is a vaccine so that we all have a basic understanding of what it is. Vaccines present diseases that can be dangerous or even deadly. They work with your body's natural defenses to safely develop protection from a disease. It helps your immune system to produce antibodies, just like if you were exposed to the disease. After getting vaccinated, you now have protection from that disease without having to get it first. And that's what makes vaccines so powerful, unlike most medicines, which are used to either treat or cure diseases. Vaccines actually prevent them. What are the benefits of getting a COVID-19 vaccine? A vaccine will help keep you from getting sick from the COVID-19 virus. All COVID-19 vaccines available in the US have been shown to be very effective. Wearing masks and social distancing help lower your chance of getting the virus or spreading it to others, but these measures are not enough. A combination of getting vaccinated, following the CDC's recommendation to protect yourself and others will offer the best protection from COVID-19. And the more people who get vaccinated, the faster we can get back to being together with friends, loved ones, coworkers, and peers. So what vaccines are available? There are 3 vaccines that have received emergency use authorization from the Food and Drug Administration from companies named Pfizer, Moderna, and Janssen, also known as Johnson & Johnson. So these 3 approved COVID-19 vaccines are safe, highly effective against serious illness, hospitalization, and death. The Pfizer and Moderna vaccines require 2 doses given at least 3 to 4 weeks apart. People should get both doses to be considered fully vaccinated for it to be effective. The Johnson & Johnson is only 1 dose. So how do we know vaccine is safe? Vaccines go through more testing than any other pharmaceuticals. There are small groups of people who initially receive the trial vaccine, and it's given to specific groups of people by age, by race, by physical health, and these vaccines is then given to tens of thousands of people and tested for effectiveness and safety. So the CDC, their Advisory Committee on Immunization Practices, looks at the data to see if the vaccine is safe and if it works. They advise the FDA, and then the FDA looks at the data and the advice from the Advisory Committee and decides whether to approve the vaccine. The vaccine is only approved after all of these steps are done and various teams of reviewers are sure that it works and is safe. So how is it so safe if it happens so fast? While the timeline was sped up, there were never corners cut around safety. So there were already helpful information about coronaviruses, so they didn't have to start from scratch. The US and other governments invested a lot of money to support vaccine companies for them to do their work. A lot of people participated in clinical trials, and so there wasn't the need to spend time to find volunteers. And then manufacturing happened at the same time as safety studies so that the vaccines were ready to be distributed once they were approved. Here's an example of the timeline compared to the traditional timeline. You can see it's the same, except that the manufacturing and development, testing and approvals were happening. Manufacturing and development was happening while testing and approvals were going on. So the next question is, can I get COVID-19 from the COVID-19 vaccines? And the answer is no. The vaccines do not contain the live virus that causes COVID-19. So this means that you can't catch the COVID-19 coronavirus from the vaccine. Do the vaccine have any side effects? Any serious side effects from vaccines, including the COVID-19 vaccine, is actually rare. It is possible that some people may have side effects. These side effects are typically normal signs that your body is building up protection, building up its immunity, and they may affect your ability to do daily activities, but should go away in a few days. Most common side effects are minor and include tiredness, headache, pain at the injection site, muscle and or joint pain, chills, nausea and or vomiting, and fever. And it's been reported that these side effects are more so felt on the second dose if you're taking the Pfizer or the Moderna vaccines. So people taking the second dose, you typically feel these side effects a lot more. There have been some evidence found during the Moderna vaccine clinical trials that people who have facial or lip fillers can experience temporary facial swelling. It's thought that it's an immune reaction and can be resolved with antihistamines or steroids in people who experience it in the clinical trials. This is not the same with Botox, which doesn't seem to cause any issues. So to minimize any risks, patients are advised to wait 2 to 4 weeks after getting dermal fillers to get a COVID-19 vaccine. And if you have received a dermal filler, you should not be discouraged from obtaining any vaccine. Here's just a graphic about who the vaccine was tested on. The Pfizer vaccine was tested on over 43,000 people, ages 16 and older within the United States, Europe, Turkey, South Africa, and South America. The Moderna vaccine was evaluated by over 30,000 people, ages 18 and over in the United States. And the Johnson & Johnson vaccine was tested on over 43,000 people age 18 years and older in the United States, Brazil, South Africa, Colombia, Argentina, Peru, Chile, and Mexico. So the question is, should someone with allergies get the COVID-19 vaccine? You should not get the COVID-19 vaccine if you have a history of severe allergic reaction, also called anaphylaxis to any ingredient in the vaccine. Vaccines do not contain eggs, gelatin, preservatives, or latex, and the ingredients list can be found at the following, and we will make these links available to you in the chat. If you have a history of severe allergic reaction to something else that's not in the vaccine, like peanut butter, you'd want to discuss that with your healthcare provider before receiving the vaccine. Would the COVID-19 vaccines affect my hormones or my hormone replacement therapy? No, the vaccine does not interfere with the efficacy of hormones. Are the COVID-19 vaccines safe for children? At this point, the Pfizer vaccine is authorized for people ages 16 and older. Moderna and Johnson & Johnson vaccines are authorized for people 18 years and older. Younger children and adolescents should not get the COVID-19 vaccine right now, although I do know that they had just started clinical trials for those who are 16 and younger. So some information should be, I'm sure, shared shortly. The next question is, will a COVID-19 vaccine change my DNA? The answer is no. The COVID-19 vaccines do not change or interact with our DNA in any way. Vaccines teach our immune system how to fight against specific viruses. And so to do this job, the vaccine doesn't need to go inside of the nucleus of the cell, which is where our DNA is kept. So this means that the vaccine never interacts with our DNA in any way and has no way to change it. Here is the distribution timeline. We are already in phase 2. If you'd like to learn more about what phase you are in, you can visit the link that's here at mass.gov COVID vaccine phases. But it is our understanding that everybody will be eligible for a vaccine shortly within the next month. And we should be getting ourselves vaccinated through phase 3. So how do I make my appointment when it's my turn? You can visit vaxfinder.mass.gov and follow these specific steps. You have to enter your zip code to identify a location near you. You have to fill out a form, and they will ask you questions like your date of birth, phone number, email, insurance information, if you do have insurance. Some places are asking for sex assigned at birth, and that's something that we can discuss further during the Q&A. For folks who can't use the internet, there's a phone number that people can use. You can dial 211 or 877-211-6277. And for those who are having a hard time scheduling an appointment, you can visit macovidvaxhelp.com, and there are volunteers who are helping people to schedule appointments. What if I need help getting to or around a vaccination site? Mass Health currently provides free transportation to vaccine appointments to anyone with Mass Health or Health Safety Net. You can call your health plan directly or Mass Health at 800-841-2900 to schedule transportation. All vaccination locations are wheelchair accessible and do not require people to use stairs. And many of these sites have a drop-off area and provide mobility assistance. Will I have to pay for the vaccine? No, absolutely not. The vaccine is free for all Massachusetts residents. You will never be asked for a credit card number to make an appointment. You can get a vaccine even if you do not have insurance, if you don't have a driver's license, or even a social security number. So you don't need any of those things to get a vaccine. Will getting the vaccine impact a person's immigration status? Good question. No, it won't. Getting the vaccine will not change whether you're able to stay in the United States, get a green card, or get public benefits like housing or SNAP. No matter your immigration status, it's important for you and your family and our loved ones to be safe from COVID-19. And so you can get a vaccine even if you don't have insurance, again, or a driver's license or social security number. What should I do if I experience symptoms after receiving a COVID-19 vaccine? If you have a lot of pain or discomfort, talk to your healthcare provider. If you don't have a healthcare provider or want to report side effects directly to the CDC, visit cdc.gov/vsafe. You can use the vSafe on a smartphone to quickly tell CDC if you have any side effects after getting the COVID-19 vaccine and to get personalized health check-ins after you receive the vaccine. How long after getting a COVID-19 vaccine does it take to be effective? How long does it last? It usually takes a few weeks for the body to build immunity after vaccination. So this means that it's possible that someone could get infected with the virus that causes COVID-19 just before or just after vaccination and getting sick. And this is because the vaccine has not yet had enough time to provide protection. Currently, we don't know yet how long the vaccines will provide protection, and experts continue to conduct more studies about whether vaccines also keep people from spreading COVID-19. The question, do I need to wear a mask and avoid those close contact with others after being vaccinated? Right now, yes, although we are hearing more, we're getting more information from the CDC as more people are being vaccinated. But currently, yes, experts continue to learn more about protection that COVID-19 vaccines provide under real life conditions. And until then, it's important to continue to cover your mouth and nose with the mask, continue washing your hands often, and doing some physical distancing, at least staying at least 6 feet away from others. So who can help make decisions? Help me make decisions about getting the vaccine. If you have more questions about your own health or about the vaccine, you want to talk to someone that you trust, your provider, like your doctor or nurse, a pharmacist or community health worker, whoever you trust, and they can help you make decisions about getting the vaccine. To learn more, we're going to put these links in the chat, but just wanted to share with you that there are also resources available so that you can keep yourself up to date about the latest plan on the vaccine, have any general questions that you have answered, as well as if you're having difficulty accessing registration for the vaccine, there are resources to help. So I'm going to stop sharing there and we can move into our Q&A portion of things. Great. So let's see in the Q&A if people have any questions. So one person has asked, would like to know how to convince those that are afraid of getting the vaccine that it's safe to get the vaccine. Will, do you want to take that question?
Sure. It's a hard one, right? I mean, geez, you can use all the information you just presented, Tre'Andre, right? To kind of reassure people of the safety of vaccines and the long history that we have regarding vaccine safety in our country and all of the diseases and the complications of those diseases that we prevent by using vaccinations. One thing that I've used for a lot of my patients who have this kind of built-in distrust for the healthcare system is, first of all, underline the fact that COVID-19 is a real virus that exists and people are getting sick and dying from it. And so I usually turn attention to the virus itself and to what we're starting to see as long-term complications of having had COVID-19. And while that varies depending on age, we're seeing long-term complications now just over a year out. And so I focus on that. You know, I think a lot of the hesitancy with some of my patients are what the long-term complications are going to be of the vaccine itself. They say, well, that we don't have much to say at all. But what we do have something to say is what the long-term complications so far have been reported for patients with COVID-19. And that's everything from lung disease, shortness of breath, heart palpitations, inflammation of the cardiac muscle, kidney injury that we're seeing. We're seeing kind of chronic fatigue, we're seeing depression, mood changes. We're seeing a lot of different symptoms that are being reported over a year out now from having COVID-19. Whether or not it's directly related, we won't know for some time, but now studies are being started or have already been started over 9 months ago, collecting this kind of data so that we can see moving forward. So I generally return attention to what we know after having had a virus, what long-term complications can present there, comparing that to other viruses of which we've learned that information about. And that, you know, especially this vaccine, understanding that this vaccine really, Tre'Andre, I like how you said it teaches your body how to fight the virus. It doesn't change your genome. It doesn't change your DNA. It doesn't do anything inside your body to make a permanent change. It really just teaches your body to recognize when this virus is presented and how to tackle it. And so it really is a benign vaccine, and this one in particular, not being a live viral vaccine. But otherwise, it is hard. I feel like this is a vaccine that has been politicized. Well, this is a virus that's been politicized, I mean, incredibly so. And so people have very strong beliefs regarding what this virus means and what this vaccine means. But I think, Tre'Andre, one last thing is that it's important, I think, to highlight that, how the vaccine was developed, and understanding that, sure, it was developed quickly, but we are in the year 2021. And we just sent a shuttle to Mars. Like, we can do this stuff, and we can do it pretty quickly. And so to say that, well, it's never been done before, well, a lot of things haven't been done before, and we're breaking boundaries and knocking down barriers all the time. And so this is just one other thing. And we had this fire lit under our butt, a worldwide pandemic that was killing millions of people. And when we put all of our minds together, we can absolutely come up with something quite quickly. So those are things. Now, whether or not that convinces people, I have no idea, right? 50-50 maybe.
And did you want to add something?
Did you call on me?
Yes.
Oh, sorry.
Thank you, Will. But yes.
Yeah, thank you. That was really great. And I agree with everything that Will said. And I guess I just wanted to also make the point, kind of maybe I'm reading ahead, but in the Q&A, the answer for the person who asked that question was about kind of getting over a fear of needles in service of a greater good. And I guess that just speaks to me about the need to understand where somebody's reluctance comes from to get it, right? Why are they afraid? Maybe it is because of the reasons about, just so much uncertainty and how fast it was made and all the things we've talked about. And maybe it's something different for somebody, and so kind of really understanding what that fear is about, I think is also an important piece.
Absolutely. Thank you, Pam. Carl?
I agree with everything that's been said. I would personally, the way I approach it, I totally take Pam's approach in terms of like, what are people thinking about? Even before they even might share that they are afraid or concerned about the vaccine, I might ask, like, what's your plan around protecting yourself and your loved ones with regards to the coronavirus? And even if we don't get to vaccination as like the end goal in terms of what I would like for their personal health and population health, we at least have reviewed all the other ways they can protect themselves and everyone else around them. But I definitely agree with Pam, like trying to find out what is the concern. And I don't really like saying hesitancy, because even vaccine hesitancy has become overly political and I think mask a lot of very real concerns. When it's not necessarily hesitancy, it could be any number of other issues. But this is one of the times also where I might share, and patients have asked me like, hey doc, did you get vaccinated? I'm like, I absolutely got vaccinated. I was like, as soon as they said I could, I was there and ready. And I even shared personally like about experiences with my family. And trying to, when you dig into what people's concern is around the vaccine, you can actually really share your personal experience getting vaccinated. You can share how you can mitigate any kind of issues. But more often, honestly, the most hesitancy, if we use that for now, is really people just being worried that they're going to have a bad reaction to the vaccine and they're going to be knocked out. And that sometimes, more often, I see this in situations where somebody is the only caregiver for children or older adults, and really trying to make sure that we explain to them like, well, we want to make sure that you are as healthy as possible to be able to continue caring for these loved ones. So really driving home what are people's understanding people's values and the concerns as it relates to the virus around that, I think is really helpful. And then again, personally sharing our own experiences with the vaccine is really, I think, is important.
Yeah, absolutely. Yeah, I mean, there's definitely that talk about, like vaccine hesitancy, as you said, right? It was really more about concerns and how that has also been pinned on certain communities as well, when we know like a lot of the communities actually don't have access to the information, right? So it's also about access to resources and information and education. Okay, let's see if we have any other questions in the Q&A. None so far, but please feel free to drop your questions in the Q&A. One of the things I think that people may have concerns about is either being able to get pregnant, or if they're currently pregnant or currently nursing or chest feeding, there may be concerns about getting the vaccine. Will, do you want to start and respond to that? People who might be concerned who are either pregnant or getting pregnant.
Sure. Yeah. So we don't have any data at all saying that it is unsafe to be vaccinated if you are pregnant, contemplating pregnancy, and or chest feeding, breastfeeding. We have no data at all to say that it's unsafe. And actually, multiple organizations, including the American College of Gynecologists, which is kind of our leading organization that gives us all of our guidance regarding care for pregnant individuals, has said very clearly, this is a safe vaccine. We recommend getting it, providing it aligns with your values and your health choices. So absolutely. And now, you know, upwards of 45 million people have been fully vaccinated in the United States as of this week. And a large number of those people are pregnant individuals. We have not seen anything that remotely even comes close to creating this belief that this is an unsafe vaccine for pregnant individuals. Live vaccines we tend to stay away from, but again, this is not a live vaccine. So otherwise, it's deemed to be a very safe vaccine, similar to the flu vaccine or tetanus.
Great, thank you.
I would also point out, like, as you've been mentioning, like, as data comes out, this gets shared very quickly is what I'm noticing, which is great. Like we're hearing reports of antibodies actually being passed through the placenta, that there may in fact be protection for the newborn child through some of the vaccinations. There was initial concern that people would have to dump their breast milk if they were vaccinated for a period of time. That is no longer a concern. And in fact, that may still confer some potential protection. But I'm putting more my researcher hat on now as well. A reminder that people have the opportunity to actually contribute information about their experience with the vaccine to the CDC. So there's a program called VSafe, which is actually a smartphone app that allows you to share any kind of symptoms, your experience of the vaccination, and any kind of issues. And they're particularly eager to hear from people who are pregnant who received the vaccine. And this will help fill in additional information for other folks. So I totally agree with Will. There's nothing to say you shouldn't get the vaccine. I would take the next step and see if you can contribute some of your own experience to the greater good as well.
Wonderful. And Carl, I'm going to stay with you on this next question that I have, which is they've recently started doing clinical trials on kids. I believe they're from like 6 months to 11 or 12. Do you have any information that you can share with our community members about that?
I admittedly am not aware of any data that's come out just yet for that. Again, not hearing any. So there's been no reports of increased adverse reactions is the most I know right now, but I haven't seen any kind of what the timeline is for eventual approval and recommendations for youth. Admittedly, I would defer to Will, given his role within Rhode Island, maybe knowing more about any additional data there.
Yeah, not much has been shared yet. I mean, the ones that we're hearing about primarily are Moderna. And by the time they reach us, so the CDC first examines the data, and then once the CDC examines the data, each state has to examine the data on their own and then create their own recommendations. And that's where our advisory committee comes in, is when it actually is approved and recommendations and guidelines are produced by the CDC, then each state will decide. But so I anticipate that's going to be a little while before we hit that. I don't anticipate that being before the summer. But Moderna is really the only one that I've seen, at least preliminarily, that they are enrolling youth under 16 to be involved. But I haven't heard much as far as Pfizer, AstraZeneca, or Johnson & Johnson yet.
Okay. My next question is more so about specifically gender affirming care and the vaccine. I know we talked about the vaccine not having any effects on the efficacy of hormones, but do we know of anything, any side effects that may be specific to like trans people? I know we did mention like lip fillers, but is there anything for us to consider regarding, our hormone therapy or, even maybe possibly getting ready for some surgeries, because we know that surgeries have been put on hold during the pandemic, and people may be starting to get their surgeries rescheduled. So any considerations specific to our communities?
I'd probably just start by saying that not in regards to effects of the vaccine. The larger consideration for me is access to the vaccine. And so, a lot of my patients are already, they're in, like they're connected with the healthcare system. But all of my trans patients, or all the trans individuals we have in Rhode Island who are not connected to the healthcare system, I worry about them and getting access. I worry about what it will mean to gain access to things like surgery or primary care in the future if you have not been vaccinated. What that will mean, we still don't know what the role of vaccine cards and vaccination status is going to be once the EUA, so once the emergency use authorization is removed, and these are officially approved as A-OK for use, now states and organizations and companies can make them mandated. And so there's no federal law that prevents a business from requiring a vaccine. And so that may very well be where we move forward once the EUA. You can't require a vaccine when it's under emergency use authorization, but once that's removed, that can happen. And so I do worry about, our community members out there who lack access or have a significant distrust for the healthcare system and are not established with primary care, and what that will mean if we don't get them access to this vaccine. So I'd say in regards to that, yes. But as far as interactions with hormones, as far as interaction in general with gender affirming care, I don't see much that raises an eyebrow for me. It's mostly access to that care.
Thanks, Will. Pam, do you have anything to add?
I was just thinking about the conversation that in another meeting recently that you kind of alluded to about being asked SOGI information while getting the vaccine, and whether that's a standardized thing, and who's the role of that, and that. I'm just curious, actually. I don't have any info about that, but if anyone does, about whether what sense does that make? I think it makes sense if they're trying to track access, and okay, these are the folks that, here's all the data, and here's who's getting it, and here's who's not, and if there is a disparity that around gender identity or sexual orientation or something. But then it would sort of seem that has to be a standard question asked of every single person across every single setting. I will tell you, when I got my vaccine, I was not asked that question. Just, so, just kind of want to throw that out there. And I don't know if the other panelists or anybody has any more information about that.
Yeah, absolutely. And I believe that the question that was asked was sex assigned at birth. There were no questions about gender identity or pronouns. And so it seemed a little bit, it didn't make sense why that question was being asked and not questions about gender or pronouns.
Right, you're right, yeah.
Yeah, we've talked about this in other settings. Data is a reflection of priorities, and you always want to understand what is the purpose of that data being collected. And as you presented, even in the vaccine trials themselves, it was very much a binary. We assume sex assigned at birth, and that there are standard forms that pharmaceuticals use in their clinical trials, and they are very reductive and focus only on binary sex, and often are very exclusionary, actually, as it relates to broader gender categories. So those kind of questions that are being rolled out now with the vaccine, my impression, and I don't know this for certain, my impression is that they're essentially like phase 4, essentially, where it's at post-market tracking and understanding. To Pam's point, which is where I'd like to lean more, is trying to understand where are the disparities and access to vaccination, and we should be asking more appropriate questions with community input on how to ask those questions to really understand where we need to go. And right now, even before the vaccines were rolled out, when we were looking at population data around the pandemic, only Pennsylvania, I think California, and forgetting one other jurisdiction, were starting to require the inclusion of sexual orientation and gender identity data in addition to race ethnicity to understand how the pandemic was affecting people. What we really need, and ideally with a better, more affirming administration is a mandate that this is part of all data collection and that this is part of understanding the vaccine rollout as well, as part of general public health, not just as it relates to this pandemic. I personally would like to see that this pandemic is a way to galvanize serving populations that have historically and continue to be underserved.
Absolutely, absolutely. And speaking of people and populations who are historically underserved, wanted to think about, were there any, in terms of this vaccine, considerations for how this might interact with any medications, such as like medications for HIV, people who are maybe living with chronic illness, thinking about considerations for those folks?
Yeah, so the majority of my patient panel, my practice, we specialize primarily in HIV and hepatitis C treatment and individuals with substance use disorders. And so what we did in Rhode Island in particular, Rhode Island got some bad publicity from that Harvard study, which looked at which states are distributing their vaccines the fastest. And we were number 50, as far as we were the slowest to distribute vaccines. But we were number 1 as far as reduced hospitalizations. And so we had reduced hospitalizations by about 80% after just a month or so. And the method in which we did that was we targeted our community members who were homeless and had substance use disorders and had developmental intellectual disabilities as our very first people we vaccinated. So we were noticing that they were, and in particular alcohol use disorder, they were comprising the majority of the hospitalizations with COVID-19. And so I think early on, we recognized that those were individuals who were at the highest risk, not necessarily based on age, because a 40-year-old with a strong history of alcohol use disorder and cirrhosis was much older than our 90-year-old, and in a lot of ways, it was at much higher risk. But as far as medication interactions, again, we have not seen any of that. If anything, we've prioritized those individuals or worked to prioritize them and really make sure that we're reducing any stigma that exists out there. Reducing those barriers so they understand this is a really important vaccine to get. And for our patients with Hep C and HIV in particular, they're not strangers to the idea of vaccinations, right? I mean, they are the most vaccinated people out there, actually, because they pretty much qualify for every vaccine and every vaccine early and sometimes multiple times. So I don't think I have not had much pushback from any of my patients living with HIV or with Hep C. But I don't know if anyone else has anything else to add there.
I see someone here in the chat has asked, have any studies been done about how this vaccine may affect folks of different races?
So I haven't seen anything on this. I'm not sure, Will, if you have. There's no indication to suspect a difference based on, we'll say, ancestry rather than necessarily race. But that being said, I don't think anybody's looking at that. I haven't seen anybody kind of put together that population data right now. I'm not sure, Will, if you've seen anything different, but right now I think the biggest thing that everybody's looking at as it relates to race categories is equity and access. Yeah,
I would agree. I think we have to be really careful when we're even looking at preliminary data in that regard, because we have to understand who's reporting adverse events, who's more likely to download the app on their phone and actually report these. And so I would assume, that's literally just an assumption, that our persons of color, they are the hardest people to get vaccinated, and they are probably going to be the least likely to actually report based on that also. But I don't know that for sure. And so I think it would be hard to collect some of that data. It's going to probably take some time before we see that. We have plenty of data on how coronavirus itself has disproportionately and grossly affected different populations, primarily regarding race and ethnicity. But the vaccine itself, I think it's still pretty early. 45 million people vaccinated, but not a whole lot of data collected yet.
Have there been any research around the effects of the coronavirus on trans people, non-binary folks, data specifically around sexual orientation and gender identity?
So I'm not sure of any actual research studies in particular, but but there's there have been lots of op-ed pieces. There have been a lot of kind of pieces written by experts regarding, worsened mood disorders, increased social isolation, difficulty accessing transportation to doctor's appointments or medical appointments, increased homelessness, poor adherence to medication regimens, things like that. I don't know of any actual hard data that we have there, but I think all of the things that, that our community members who are LGBTQ identifying already experience just worsened, right?
Absolutely, yeah.
I just want to double back, Tre'Andre, you were asking as it relates to the pandemic or as it relates to vaccination?
This one was specifically related to the pandemic.
So there has been some work, again, very early on, we're not getting good systematic data collection from state authorities or the government necessarily. So we're relying very heavily on private organizations and not-for-profits do that, which are great, but not the ideal where I want it to be. But there's been good reports coming out of the Williams Institute, Human Rights Campaign, the Kaiser Family Foundation actually just released a report. I want to say, I'm just looking now, I think about like 2 weeks ago, that really looked at that essentially real-time effects of the pandemic on LGBTQ individuals. And again, really echoing everything both said, because early in the pandemic, we had myself and many of us who were doing this kind of writing and pontificating, were really basing it on what we understood about population health at that time, what we understood that was really affecting people in terms of multiple comorbid conditions, people who had less access to resources and were more isolated. A lot of that we already knew about LGBTQ individuals, and we already knew that we were seeing that in the pandemic. So there was the assumption that there was going to be an overlap there. The data is bearing that assumption out at this point. I don't think we're going to fully understand the effects of the pandemic on our LGBTQ communities for like another year, because often a lot of data on LGBTQ folks lags a lot within the state surveillance systems. But it is everything that Will said, that we are seeing what we assumed we were going to see last year. That being said, I feel like this is a reminder that we should really be collecting this data more routinely, and naturally always making it optional. I don't want anybody to feel they have to out themselves if they are. I see somebody use the term stealth in the chat. I don't expect anybody to out themselves, but to recognize that when somebody's asking a question, you should always feel empowered to ask, what is the purpose of this question? And in this situation, it is to understand population health.
Absolutely. Thank you, Carl. And to that person's question, actually, I'll post this to Pam. So the person wrote, so the question regarding birth sex is for research purposes. That was a question, and has nothing to do with our treatment. It forces those of us who are self to out ourselves. How would you respond to that person?
Yeah, well, I mean, I agree. I think I had misspoke about what the question was, and the question assigned sex at birth is really not appropriate in my opinion. There's no reason, well, is there a reason? You ask people need to feel comfortable to share what they feel comfortable with, and you can't, and so that is not necessarily a comfortable question. Whereas, sexual orientation and gender identity, it's a softer question. You still can say whatever you want, but I think that there's more it just makes more sense that you're collecting that kind of information. But again, to the points that have been raised about making sure the person asking that question has a very clear reason for why they're asking and can explain what they're going to do with the data. But I would agree with the person who wrote that in the chat, that assigned sex at birth to me doesn't make like any sense. I don't think that they should have asked.
Yeah, absolutely. And again, like you said, if they're going to ask that question, to make sure that they're explaining why they're asking the question and what they're going to be doing with the data. And in addition to that, also ask about gender identity, sexual orientation, and pronouns.
Yeah, that's the biggest issue for me, is that it's a standalone question. And it doesn't have any follow-up regarding gender identity in there.
Yes, absolutely. So see, we have about 5 minutes left. I'm just wondering really quickly, sort of like some of the conversations that you might have been having with your patients. Is there anything that you think, anything that we didn't touch upon tonight that you would like to share with our community members?
I think nobody should make you feel bad about choosing or not choosing to get vaccinated. It is still a personal choice. It is as a healthcare professional. Naturally, I have my thoughts, the evidence to back up getting the vaccination, but it's still a personal choice. And honestly, individual choice is a priority. So I don't appreciate when I hear colleagues in different settings saying, I don't understand why somebody isn't getting vaccinated, how irresponsible or wrong. I don't think that's an appropriate way to really approach this. Again, always coming forward first, trying to understand what people are thinking about as it relates to the vaccination is important. And then ideally, if you can provide enough information for them to make a choice to get vaccinated, great. And if they still choose not to, also totally fine. I think it's really important to remind people of that, that they will still should be allowed to continue gaining access to healthcare services, regardless of vaccination status or not. So I think that's one thing that we haven't said, and I think it's really important to reiterate that personal choice is important.
Thank you, Carl. Will, anything to add to our viewers and community members?
I would say, so one of the things I do here for the state is I run a lot of the vaccine clinics. So, personally, I've put a vaccine into probably 3,000 or 4,000 people's arms so far. And I will tell you that by and far, the reaction is a reaction of relief when someone gets their vaccine. Even if they were, and I have sat by their side for 15 to 30 minutes, holding their hand before we gave the vaccine, to really help relax them, to talk them through this. And then the moment they got their vaccine, first of all, they didn't feel it. Maybe the day after they felt it. But at the moment, they really didn't feel the vaccine itself, or was very minimal. And it was just a feeling of relief that people have, and that they did it. And so I guess my message would be, that a lot of people have had this vaccine. It is a very safe vaccine. It will obviously speed up our kind of getting back to normal, the more people who get vaccinated. But I do think that there is still plenty of time to ask questions and to gain that trust and that confidence in this. And I think that most medical providers are going to be patient with you regarding that. They want to answer your questions, and they want to be sure that you're making the right decision for yourself. And I absolutely agree with Carl that we don't want anyone to feel pressured. We don't want to create a stigma among unvaccinated individuals. Like, we want, if anything, to embrace as many people as possible and as many belief systems as possible, and make everyone feel as welcome as possible. But I will say that I think that was an eye opener for me, that feeling of relief that people express after they do get their vaccine. So.
Thank you for sharing that, Will. And Pam, any last words?
Just to echo, we in Boston as well prioritized shelter guests sort of in the beginning, and some of the photos that were shared of people just so happy to be getting that, and I think for me, back to your question, Tre'Andre, the conversations, a lot of them really have been, when can I get it? Where can I get it? Why can't I get it now? My friend got it. People are getting stressed about that a lot of time, and so I just really hope that we keep hearing this news about these, millions of vaccines that, have come to Massachusetts, and wonderful. Let's get them into people. And yeah.
Wonderful. Thank you so much. I just want to thank again, Pam, Will, and Carl for joining us at our informational forum. I hope you walked away with some information about the vaccine that you can also share with your loved ones and community members. If you have any questions, if we didn't get to any questions that you weren't able to ask, email info@masstpc.org, and we'll make sure to respond to you. And we hope that you have a wonderful evening. And thank you again for joining us.
Great. Nice meeting everyone.
Yeah, thank you.
Take care. Stay safe.
And thanks to our ASL interpreters and our live captioner. Thank you so much. Okay.